Hello, welcome to the Diabetes and Chronic Kidney Disease webinar. My name is Caroline Koroneff, and I'm a credentialed diabetes educator. The kidneys are intriguing organs. You're probably well aware that most of us have two of them, and that things can go wrong with the kidneys. But how would this affect you? So in this webinar, we will explore how the kidneys work, what type of kidney problems can you get, and what is chronic kidney disease, or CKD in particular? What are the stages, and what are some of the reasons and causes for people to develop kidney trouble? How do I know if I have CKD? What tests can be done to find out if I have any problems with my kidneys? What are the risk factors? And most importantly, what can you do to reduce your risk? Looking after your kidneys is essential, especially when you have diabetes. Having healthy kidneys helps keep your body in good condition and improves your general well-being. The kidneys are two bean-shaped organs, each about the size of a fist. They are located underneath your rib cage towards the back. Your kidneys are a vital part of your body. They have many important jobs, such as cleaning off the blood, keeping red blood cell counts normal, getting rid of waste and extra water by making urine, keep your body chemicals in balance, help keep your bones healthy and strong, and help maintain healthy blood pressure, at least in part by getting rid of some excess salt and fluids in the urine. Blood enters the kidneys through the renal artery. The kidneys remove excess fluids and waste materials from your blood through units called nephrons. Each kidney contains more than 1 million of these nephrons, which are tiny filtering units. Inside each nephron is a glomerulus that acts like a strainer to clean the blood, and it has a network of tiny blood vessels called capillaries. The multiple for glomerulus is glomeruli. The glomeruli filter waste products and substances your body needs, such as sodium, which is a type of salt, and potassium, which then pass through tiny tubes called tubules. The substances your body needs are reabsorbed into your bloodstream. The clean blood with imported nutrients is then sent back to your body via the renal veins. Urine is made with the waste and the extra fluid your body does not need, and is sent to the bladder through a tube called the ureter. When your kidneys aren't functioning as they should, waste gradually builds up in your body, and this can have a devastating impact on your health. This condition is called nephropathy, or kidney disease, the loss of normal kidney function over time. It is sometimes also called kidney or renal failure, which is really the end state of kidney disease. Nephropathy can be roughly divided into two: acute kidney injury and chronic kidney disease. Acute kidney disease is the temporary loss of kidney function lasting less than 3 months. It typically has a fast onset in response to an injury or an illness affecting the kidneys. Drugs, blockages of the kidney, such as due to kidney stones, or many other factors. Some people will need a short course of dialysis to help the kidneys recover. Many people fully recover from an acute kidney injury and go on to live a normal life. However, if significant damage has been caused, there is a higher risk of developing chronic or ongoing kidney disease later on. Because of this, if you have had an acute kidney injury, it is important to properly monitor the health of your kidneys for the rest of your life. You should follow a healthy diet and should have your kidney function checked every 2 years by your GP. Chronic kidney disease is the most common form of kidney disease. Chronic kidney disease, or CKD for short, occurs when your kidneys have been damaged in a way that cannot be reversed. To be diagnosed with chronic kidney disease, the condition will need to have been present for at least 3 months. You can live a normal life for many years with CKD. However, many people will experience a continued decline in the kidney's ability to filter their blood and will eventually need kidney replacement therapy. This may be in the form of dialysis or a kidney transplant. There are many potential causes for chronic kidney disease. The two main causes of CKD, you may have already guessed these, are diabetes and hypertension or high blood pressure. Together, they are responsible for up to 2/3 of all cases. Other causes for CKD include genetics, infection, and immune disorders, and these are responsible for the rest. These can include diseases like glomerulonephritis, which is an inflammation of the kidney's filtering units, interstitial nephritis, which is an inflammation of the kidney's tubules and the surrounding structures, pyelonephritis, a recurrent kidney infection, or polycystic kidney disease, and prolonged obstruction of the urinary tract from conditions such as an enlarged prostate, kidney stones, and some cancers. According to Kidney Health Australia's Chronic Kidney Disease Management in Primary Care Handbook, approximately 1.7 million Australians over the age of 18 have indications of CKD, such as reduced kidney function and/or albumin in the urine. That is around 1 in 10 Australians. It is estimated that 1 in 3 Australian adults has risk factors for CKD, and it is believed that CKD is twice as common as diabetes. People with CKD have a 2 to 3-fold greater risk of cardiac death than people without the condition. And CKD is a stronger risk factor for future coronary events and all-cause mortality than diabetes. So to check if you have any problems with your kidneys, you will need to go for urine and blood tests regularly. A blood test is done to measure your estimated glomerular filtration rate, or eGFR. And this tells how well your kidneys are actually cleaning your blood. The eGFR helps to classify your disease into stages. We'll have more on this shortly. Urine tests. Kidneys that are damaged can leak substances into your urine that should be kept inside the body. One of these substances is a protein called albumin. Too much protein in the urine is a sign of kidney damage and can scar the kidneys. The amount can be measured by testing your urine. Blood pressure checks are also very important and should be done frequently by either your doctor or your healthcare professional. So what should your blood pressure be? Well, blood pressure has 2 numbers, which are the systolic blood pressure, which relates to when your heart beats, which is the higher number, and the diastolic blood pressure, which is a measure of your heart at rest, the lower number. Ask your doctor what your blood pressure is and what it should be. Now, this table gives you some idea of recommended blood pressure for the average person. For a person who has no diabetes, no kidney disease, or other medical conditions, it is generally recommended to aim for a blood pressure of around 120 on 80 millimeters of mercury or below. If you have diabetes or protein in your urine, you will most likely be advised to keep your blood pressure at 130 on 80 or below. When a person is diagnosed with CKD, the target is usually set a little bit higher at 140 on 80 or below. Now, I have heard people say my blood pressure is 13.5. This means that the systolic blood pressure is around 135 millimeters of mercury. If you have high blood pressure, it may be causing kidney damage. This is because the high blood pressure damages the many small blood vessels in the kidneys. Kidney disease also causes high blood pressure. Blood pressure tablets lower blood pressure and help protect the kidneys, so are sometimes prescribed even if your blood pressure is at target. CKD is divided into 5 stages. The more damaged your kidneys are, the less function they have. In the early stages, stages 1 and 2 of CKD, most people feel normal. There are no obvious symptoms present. If your CKD is in the early stages, it is important to talk to your doctor before starting any new medications, including vitamins, natural or herbal medicines, and over-the-counter medications. Management of CKD includes keeping your blood glucose levels and your blood pressure as much in a normal range as possible and making healthy lifestyle choices. Discovering kidney disease during stages 3 and 4 is much more common as the level of wastes of urea and creatinine in your blood rises. You may begin to feel unwell and notice changes in the number of times you pass urine. As the kidney function slows down, your blood pressure may rise. Management of your blood pressure and the aforementioned blood glucose levels can slow the progress of kidney disease and reduce the chance of other complications. However, even with the best management, CKD sometimes leads to stage 5 or end-stage kidney disease. At this stage, your care team will start talking about dialysis with you. This image highlights the different stages of CKD and the associated eGFR level. For example, a person with an eGFR of 49 millimoles per minute has 49% of normal kidney function and would be at a stage 3 of kidney disease. If your CKD reaches an advanced stage, so stages 4 or 5, or an eGFR below 30, your family doctor will refer you to a kidney doctor called a nephrologist. Along with a team of other healthcare professionals, they will provide you with specialist kidney care to help you further manage these risks. Besides the blood test, your doctor will also organize urine tests to check how much albumin is leaking out of the kidneys. It is normal to have a small amount of albumin leak out, so the so-called albumin to creatinine ratio, or ACR test, will rarely be 0. For well-functioning kidneys, we would expect an ACR of less than 2.5 for men and less than 3.5 for women. This is highlighted by the green section of this chart. The urine test is quite a sensitive test, so usually the doctor will repeat the test if the result is elevated or as false positive results can occur. For example, when the person has a urinary tract infection, for women who are menstruating, after vigorous physical activity, and sometimes in response to a high protein diet. If the albumin creatinine ratio is between 2.5 and 25 for men and between 3.5 and 35 for women, it is referred to as having microalbuminuria, whereas if levels are above 25 or 35 respectively, it is referred to as macroalbuminuria. The urine ACR check is not a hugely specific check, but it is an easy and cheap test to perform. And at least it will tell us if we have anything to worry about. If your doctor asks for a urine sample to perform this test, I recommend that you do this as an early morning sample rather than later during the day, and that you take the midstream of the urine. In other words, urinate a small amount into the toilet, then pee into the jar that your doctor will provide you, and then the rest into the toilet again. By letting some of the urine pass first, you can reduce the risk of false positives, as the first few milliliters will clean your urinary tract. The symptoms of CKD can be different for everyone. In the early stages of kidney disease, there may be no symptoms at all. That is why it is important to regularly check the functionality of your kidneys as part of your annual cycle of care. The signs and symptoms of chronic kidney disease develop over time if kidney damage progresses slowly. Chronic kidney disease may not become apparent until your kidney function is significantly impaired, stages 4 or 5. As kidney disease worsens, there may be changes in how often you pass urine and how much you urinate, the color and the consistency of the urine you pass. Other late symptoms may include nausea and vomiting, loss of appetite, tiredness, weakness, difficulty sleeping, and headaches. People can also experience unusual persistent itching, muscle cramps, loss of concentration, shortness of breath, swollen ankles or edema, angina or chest pain, unexplained weight loss, and more difficult to control blood pressure, often despite perhaps multiple different blood pressure lowering medications. As mentioned, having CKD means that your kidneys have been damaged, usually slowly over a long period of time, months or years. The damage means that your kidneys are not working well anymore, and that can cause a buildup of fluids and waste, which can, amongst other things, lead to development of edema, which is a fluid buildup in other parts of the body, such as in the legs and around the heart. It can also cause a mineral imbalance, such as a sudden rise in potassium levels in your blood. That is a condition called hyperkalemia, and that could impair your heart's ability to function and may be life-threatening. It can also cause hypertension or high blood pressure and cardiovascular disease, anemia, a low number of red blood cells, osteoporosis, which is weak bones and an increased risk of bone fractures, and irreversible damage to the kidney, also referred to as end-stage kidney disease, which may lead to you requiring either dialysis or a kidney transplant for survival. CKD is permanent, but sometimes the damage can be slowed down through different treatments prescribed by a doctor, as well as through healthy eating and exercise. It is important to note that if you have kidney disease, you're also more likely to have other diabetes-related complications, such as heart disease and damage to nerve and eyes. So it's important to get that looked at as well. Now let's have a look at the risk factors for developing CKD. As diabetes and high blood pressure are two of the main causes for the development of CKD, it will come to no surprise to you that having either or both of these conditions increases your risk. Other risk factors include cardiovascular disease. As having cardiovascular disease means that there is damage to the heart and blood vessels, and that would be including the blood vessels to the kidneys. Having an abnormal kidney structure or a history of acute kidney injury, being overweight, having a family history of nephropathy, being older can increase your risk, and having a high salt intake of any kind can increase blood pressure and can increase your risk for developing CKD. Smoking is another risk factor because, again, this can block your, cause obstructions and blockages in your blood vessels. And Indigenous Australians have been found to be at higher risk of CKD than any other ethnic group, even at a younger age. Now, some of these risk factors, such as your age, family history, ethnic background, or having an abnormal kidney structure, are not things you can change. but some of the others, perhaps you could. Many people with diabetes who develop CKD stage 4 or 5 are told to change their diabetes medication due to their effects on the kidneys. The way this is often explained would make you think that the diabetes medications are responsible for the damage to the kidneys, but this is not the case. Diabetes medications, diabetes medications are safe for the kidneys, but as many diabetes medications are excreted through the kidneys, so getting rid of out of the body through the kidneys, if your kidneys are not filtering well, it would mean that the medications remain in your bloodstream for longer than usual, and that makes them work stronger in a sense. Metformin is the most common medication used for diabetes, and as metformin is one of those medications that is excreted through the kidneys, the dosage often has to be reduced if kidney function is reduced. And that's to prevent the buildup of this medication, which could lead to lactic acidosis. Lactic acidosis is a buildup of lactic acid in the muscles, and that can cause severe cramps. For most people, the maximum dosage of metformin is 2,000 milligrams per day. But when the eGFR drops below 45, the maximum dosage is usually reduced to just 1,000 milligrams per day. And with an eGFR under 30, metformin is generally reduced to no more than 500 milligrams per day or stopped altogether. Similarly, sulfonylurea medications such as diamipron, Gliade, Dainil, Amorol, Dimerol, to name just a few, will also need to be reduced as their half-life is extended if your kidney function is reduced, and this can increase your risk of hypoglycemia, low blood glucose levels, as these sulfonylurea medications stimulate the pancreas to produce more insulin. So if they're in your body for longer, you get more insulin in your body as well. SGLT2 medications such as Jardiance and Forxiga, or combination medications with an SGLT2 such as Jardiamet, Sigduo, or Glixambi, will have to be stopped when the eGFR drops consistently below 45. And this is because of the reduced glucose lowering effect with reduced kidney functions. Often insulin treatment is recommended if the eGFR is below 30, as it is a much safer option at that stage. Now, I know that many people are reluctant to start insulin injections, but I can reassure you that they are very easy to do, and an insulin injection hurts less than the finger pricks that you do to check your blood glucose levels. Now, of course, if you have any concerns about the medications you're taking, please talk to your doctor, your pharmacist, or your health professional, or you could ring the helpline and speak to one of our credentialed diabetes educators. To reduce your risk of developing kidney disease, it is important to manage your medical conditions. You do this with your doctor's help. If you have diseases or conditions that increase your risk of kidney disease, such as diabetes, high blood pressure, or high cholesterol, work with your doctor to control them. Ask your doctor about tests to look at signs for kidney damage. Salt is excreted through the kidneys and will make your kidneys work harder. It is important to reduce your salt intake by not adding any salt to your cooking or at the table. Minimize your processed foods such as sausages, ham, and canned food, as salt is often used as a preservative. And avoid soy sauce and fish sauce. Choose low salt options if possible, and available as much as possible. It's also important to maintain a healthy weight. If you are at a healthy weight, work to maintain it by being physically active most days of the week. If you are overweight, talk with your doctor about strategies for a healthy weight loss. Often this involves increasing daily physical activity and reducing your caloric intake. Your GP prefers a GP management plan, and this will enable them to refer you to a local dietitian or exercise physiologist, whilst enabling you to get some Medicare rebates. You can, of course, also call the NDSS helpline and speak to one of our dietitians or exercise physiologists for advice. They are very experienced health professionals who can point you in the right direction. To prevent kidney disease, it's also important to not smoke. Cigarette smoking, as mentioned before, can damage your kidneys and make existing kidney disease worse. If you are a smoker, talk to your doctor about strategies for quitting smoking. Support groups, counseling, and medications can all help you to stop. And follow instructions on over-the-counter medications. When using non-prescription pain relievers, such as aspirin, ibuprofen, or acetaminophen, follow the instructions on the package. Taking too many pain relievers could lead to kidney damage and generally should be avoided if you have kidney disease. Ask your doctor whether these medications are safe for you to take and what the maximum dosage should be. Now, urine color can tell us a lot. The color of urine can range from a pale yellow to strawberry yellow to a dark brown. Healthy urine should be pale yellow and clear. The amount of water in your body is called hydration. And hydration is related to the amount of water you're drinking each day. Heat and exercise affect your body's hydration levels. It is important to drink water when exercising or in hot weather. A sign of your body having enough water, so being well hydrated, is that your urine will look that pale yellow color. If your body does not have enough water, your urine will be darker. So speak to your doctor if you notice any frothy urine, which could be a sign of protein in the urine. If you have any unexplained changes to how often you pass urine, if you have urgency or pain, blood in the urine that is not due to a menstrual period, or a changed urine color. It is important to note this can be due to some foods as well, for example, beetroot, or sometimes due to medications. And a healthy diet should include a good variety of nutritious foods, and you should watch your serving sizes, even of the healthy nutritious foods, as excess in calories can equal weight gain. Healthy eating tips include eating lots of fruit, vegetables, legumes, and whole grain bread and rice, eating some lean meat such as chicken and fish at least once a week. Cut back on snack foods with high levels of saturated fat, sugar, or salt. Healthy alternatives include fresh fruit, low-fat yogurt, but check for the added sugar, and unsalted nuts. Limit takeaway and fast food meals as an occasional treat. And add flavor to your meals by using things like lemon or lime juice, onion, garlic, chili, pepper, herbs and spices instead of salt. A good balance between exercise and food intake is also important for good health and weight management. A dietitian can help you choose foods that will keep you healthy without overloading your kidneys. They can educate you regarding kidney-specific diets, such as a low-potassium diet or a low-protein diet, or if you have to follow fluid restrictions. Potassium is a mineral found in many foods, which helps your nerves and muscles work. Healthy kidneys remove extra potassium from your blood, but if your kidneys are damaged, the potassium levels could rise and affect your heart health. So a dietitian would be the right person to help you choose foods with the right amount of potassium for you. And similarly, protein builds, repairs, and maintains your body's tissues and fights infections. It is found in meat, fish, legumes, and dairy products. When your body breaks down protein, a waste called urea is formed. As your kidneys fail, urea could build up in your blood and can cause side effects like tiredness, nausea, headaches, and a bad taste in your mouth. So a dietitian could help you choose foods with the right amount of protein for you. And the nutritional information panel or the food label can help you work out healthier options, but it can also be a challenge to figure it out. So a dietitian can help with this too. And as mentioned before, there are many benefits to regular physical activity. Not only can it help to reduce and maintain weight, but it can also reduce the risk of developing heart disease, diabetes, and kidney disease. You only need to exercise for about 30 minutes a day on at least 5 days of the week to reap the benefits. Choose exercise that you can enjoy. You don't need to sweat it out at a gym. A brisk walk is great too. And as we're all different, we have different needs, we have different wants and likes, an exercise physiologist can provide you with tips and tricks and a personalized exercise regimen based on your physical limitations. In many instances, your time with your doctor may be limited. It is helpful to prepare for the visit in advance. And this may include making a list of questions so you don't forget anything. Include any symptoms, concerns, or changes in your life since your last visit. Rank your questions in order of importance, just in case you run out of time. And when you get to ask your questions, make sure you write down the answers. Don't trust your memory. Most of us remember less than half actually, of the information that we are given. Know the name and dosage of all your medications, including any over-the-counter medications. Consider taking a list of your medications to your doctor, or take all the bottles and packets with you if that's easier. Tell the doctor if you are getting advice or treatment from other health professionals, including complementary therapies, vitamin supplements, or herbal treatments. If you need repeat prescriptions, make a note to ask for them. And giving a written record of your major past medical and surgical events to the doctor on your first visit is an excellent idea. Knowing about your family's medical history is also helpful. If you don't know a lot about your condition, ask for some written information. This will help you understand and become familiar with the medical terms so that it is easier to discuss your concerns with your doctor. It is not uncommon during the first few visits to your doctor to feel overwhelmed or forget what your doctor said. So you might want to consider bringing a family member or a loved one to your first few visits. Having another person there to help ask questions and review the information with you afterwards can be extremely helpful. If you think you may not be able to follow any instructions, tell the doctor immediately to avoid problems later. If you have a chronic illness, such as diabetes, consider keeping a written record of your contact with all your healthcare professionals. And when you visit any health professional, remember that they are there to advise you about your condition so that you can make an informed choice. As a patient, you have the right to ask questions about your treatment, to be informed about the details of your care, for example, costs involved, to be informed about treatment options, and to get a second medical opinion. Doctors expect and understand, and in some instances even advise, that their patients seek a second opinion. Don't worry about hurting the doctor's feelings if you ask for one. Get information from other sources about your condition and its treatment can also be really useful. Now, if you are looking for information from other sources, it is of course important to use reputable sources. The NDSS website is full of evidence-based resources, And Kidney Health Australia is another trustworthy source of information. If you'd rather talk to a healthcare professional, you could ring either an NDSS helpline on 1800 637 700 or the Kidney Helpline on 1800 454 363. Thank you for watching this webinar. I hope you found the information provided useful. If you have any further questions, please don't hesitate to call us on the NDSS helpline on 1800 637 700.